Welcome to my channel. My name is Dr. Goldstein. Let's start. Arrhythmia is an abnormal heart rate that you already knew. An example is atrial fibrillation, Winky-Bach, and Mobitz type 2. Bradycardia is too slow. Tachycardia is too fast. Others make the heart not long last. And ECG is your BFF, your best bud in a way, to closely watch your patient and help save the day. The ECG and the pulse should be monitored together. If they do not match, you should be alert for whatever. An abnormal heart rhythm can be acute or stable. However, its importance shouldn't be brushed under the table. There are 4 classes of drugs that we use to treat these. These meds help the heart give a regular and proper squeeze. We group them by class from 1 to 4. Most are straightforward, but class 1 has drugs galore. Class 1 are sodium channel blockers, a mouthful, I know. Your cardiac conduction, these drugs will slow. You likely remember the sodium-potassium pump. It helps the heart give a good, healthy thump. By interfering with these channels, the heart rate will slow. Hopefully, the arrhythmia will thus come under control. Because these interfere with cardiac conduction, your heart rate will slow, ideally returning to proper function. We are discussing class 1, and these are divided into 3. Procainamide is the oldest, so first it should be. Class 1A, procainamide is the one. Let's learn its black box warning. It'll be fun. This drug can cause problems you'll see. Lupus-like syndrome, blood disgraces, and some irony. The irony is, arrhythmias this may cause. You can still give it though, no need to pause. If it comforts you any, you should also know, this drug can also cause your heart rate to slow. Arrhythmia's slow heart rate, this cannot be. Yet it is, and the same for others, as you will see. Lidocaine is class 1B. It is next for us. Let's examine and see. This drug is the same class and has the same MOA. However, this one is used in more than one way. Lidocaine is well known as an anesthetic, so pulling out teeth won't make you cry, so pathetic. CNS side effects from this way you may have had, such as making you hallucinate or outright mad. Abnormal ventricular rhythms is what this drug is used for. It cannot be used in WPW, heart blocks, or trouble is in store. Class 1C is the final of these 3. These are the newest of them, so let's examine and see. Flecainide, propanone, not easy to say. Yet for one with an arrhythmia, it might save the day. It has black box warnings. 2 of them come to mind. One we know is ironic, and the other is the awful kind. It says it may help your rhythm, but not help you live longer. This is important, as we all want to be healthy and stronger. Fear not, we do still use this medication. This warning serves for you to simply give consideration. We have now finished the sodium channel ones. We move on to those that are used by the tons. Class 2 antiarrhythmics are much better known as beta blockers that you have previously been shown. These drugs have many uses, as you have seen before: hypertension, arrhythmias, angina, anxiety, and more. Blocking beta receptors is what these drugs do, reducing heart rate, cellular excitability, and resolving arrhythmias too. Labetalol, esmolol, and propanolol are the drugs in this class. Thankfully, we learned these in the recent past. But surely you may recall the patient teachings for these. Fatigue, bradycardia, and your dose cannot abruptly cease. As a nurse, you will always assess their pressure and heart rate. Now let's cover class 3 before it's too late. The potassium channel blockers are in class 3, more commonly known as amiodarone, as you will see. These drugs work as the name does sound. They block potassium channels as things move around. The effect this has on cardiac conduction, things slow down and return to proper function. A common theme you may have noticed occurring: antiarrhythmics slow the heart so that it can keep purring. Amiodarone is the one we're speaking of now. It also lasts in our system up to 5 months somehow. The same side effects go here too. Bradycardia, arrhythmias, but let's list some that are new. This drug causes pulmonary toxicity. Be careful giving this in those with decreased lung capacity. You should also not take it with a glass of grapefruit juice. When one is pregnant, it should not be in use. It is toxic to the liver and causes hypotension. Other than all that, it is really a great invention. Black box warnings, it specifically has three: pulmonary toxicity, worsening arrhythmias, and hepatotoxicity. Calcium channel blockers are the fourth class of drug. Verapamil and diltiazem are the two we are speaking of. As we've seen before, when certain channels are blocked, the heart rhythm stabilizes and the boat is no longer rocked. These drugs serve other needs. You have seen them before. They treat angina, hypertension, now arrhythmias, and more. Non-dihydropyridines is a term you should know. These drugs dilate the vessels, and your rhythm and rate they will slow. Not to be left out, these drugs do as well have the ironic side effect that is not so swell. 4 groups of antiarrhythmics we now learned well. We have one less drug. About it I shall tell. The drug is adenosine. You've heard of ATP. It is used to diagnose and treat SVT. When the heart rate is going so super fast, this drug can be given and it long does not last. A mere 10 to 15 seconds and this drug is not around. Hopefully the arrhythmia is also no longer to be found. It is ATP, cellular energy, and makes the heart stop. This works as every heart cell fights for a free drop. You must have your patients hooked to an ECG. Its effects can wear off very quickly, you will see. You should also caution your patient for its surprising feeling. It can feel like your heart stopped and send your patient reeling. You should give this as close to the heart as possible, as every cell will want free ATP. That is highly probable. Chemical conversion is another name this goes by. It is not as much fun as shocking, but maybe a better try. So what have we learned? Oh, so much. Check the heart rate, ECG, and the pulse you should touch. One thing that hasn't gotten a mention, an arrhythmia might require for blood clots and intervention. If blood is not moving as ideally as it should, blood can form clots that it not otherwise would. We are now at the end. So much has been said, but also know some rhythms require more than just a med. We may need to shock a patient to reset their heart. This is done before the medication can do its part. You should also be checking any abnormal heart rate for an electrolyte imbalance that can be causing its fate. As a nurse, you'll want to watch things closely. A cardiac monitor is the answer, surely and mostly. Have a great day and help keep this channel busy, learning all about meds so that pharm won't make you dizzy.